Yeah, in our practice, we don't guess, we measure. And I know what you're thinking out there, especially you that have never been in our practice. What on earth is this little race car that Dr. Jason is having? Well, in our practice, like I said, we don't guess, we measure. When it comes to your kids' health or your health, you need to know the facts. You've had enough opinions that have got you right to where you are, which is most likely a place that's not that healthy. What this is one of 3 objective, clinically relevant scans that we utilize on everybody in our practice to know exactly what's going on with a child's neurology. One of the primary functions of the brain and nervous system is to regulate our temperature at 98.6. What this scan actually does is called thermography. It measures the temperature all along the nerve root level on both sides, and we expect and hope to see that the temperature is the same on either side. But with irritation, stress, disconnect, misalignments, we're able to zero in on the root causes of whatever that symptom might be. Now, symptoms can be something as simplistic as low back pain or a headache or sciatica, and complex as autism, ADHD, and sensory challenges. But no matter the condition, no matter the diagnosis, the most important question you can ask is why? What is at the heart? What is at the very root of these symptoms? And when you can use technology like this, we can know exactly what's going on. I said this was one of 3. The other scan that we actually use is developed by neurologists. It's called a surface Emg scan. And what it does is actually measure the electrical activity of the muscle, the energy of the muscle, how much stress is on that tension, how much weakness is in that system. So we can measure each level of the spine to find out exactly how that body is holding its stress. The last test we used, actually Harvard Medical Review just did a study on this last summer. We couldn't be more excited because it gives us so much relevant data as to how that entire system working. So we had the thermography, the second scan was EMG, surface EMG, and the last scan that I'm mentioning right now is called heart rate variability. What it actually measures is that balance between sympathetics, fight or flight, and parasympathetics, rest and digest. We need a balanced, connected system that doesn't show signs of irritation and stress, that doesn't show signs of tension, and that overall system is working for you instead of against you. This is something that we find out right out of the chute. We don't even talk before we do these scans. We measure first and then have the conversation about what you're feeling and what your expectations and hope are for your health. But it all begins with a measurement so that we can know without any reservation of doubt exactly what's going on with your neurology so that we can give you the detailed blueprint that you've been looking for, but most importantly that you deserve. That's what everybody deserves in our practice, and that's what everybody gets. If you have questions about this technology, is it safe? Of course. Yeah, there's no radiation here. It's perfectly safe to use on a newborn baby or a pregnant mom. There's nothing going into the body, and just as important, there's nothing coming out, but it allows us to see exactly what's going on so you can get the best results possible.